Real Housewives, they're starting to use testosterone because, these ladies are getting a little bit further in age. They're, menopausal or postmenopausal. I'd also like to talk about low testosterone in men and how dangerous that is as well.
Testosterone in women is not elective. We always think of estrogen as the dominant hormone, and it absolutely is. But testosterone for women, it is an absolute necessary hormone.
I think with a man with a high testosterone, there's studies on this. They're a lot more decisive in their decision making. They're a lot more protective, and they stand up for what's right. So that's why it's really important. If you're a younger man, if you want to be fertile and reproductive in the future, you're going to have to do post-cycle therapy, and also know that there's a risk that you may also lose fertility. I know that's still a risk. Welcome to Balanced Conversations. I am Anthony Dodato, and this is
Rochelle Bonasha.
And we are going to talk about why testosterone, or low testosterone, is more dangerous than you think. So I think we need to dive a little bit into testosterone, mainly because we're seeing a change in the way that society is seeing testosterone, the way that medicine is seeing testosterone, and the way that testosterone has just been so demonized, and it needs some respect again. Mm-hmm. So when I say that, we're seeing people like, the Kardashians, or even a little bit further, what is the girls, the ladies, Real Housewives. The Real Housewives, they're starting to use testosterone because, these ladies are getting a little bit further in age. They're, menopausal or postmenopausal, and they're starting to have some symptoms related to that low testosterone. I'd also like to talk about how that low testosterone in men and how dangerous that is as well. But starting with women, now that we're seeing that it's becoming a little bit more acceptable just generally from people and women, and also there's been a position statement recently that, in the medical community, that's saying that testosterone does have its place for menopausal, postmenopausal women, specifically related to hypoactive sexual desire disorder. So what does that mean?
Well, and to your point, testosterone in women is not elective. Your body has to have testosterone. When you're a woman, it utilizes it significantly. So we always think of estrogen as the dominant hormone, and it absolutely is. But testosterone for women is not an elective hormone. It is an absolute necessary hormone for women. And that is a common misconception. We naturally produce testosterone, and we naturally produce it for a reason.
Right. So what are some of the effects of testosterone on a woman's body or even a man's body? So it's, preserving muscle, which is extremely important as you age, related to metabolic effect and strength, bone strength, fat distribution throughout the body. It's really important for energy. We just talked about sexual function. So testosterone has its place.
Hair thinning.
Yes.
Yeah.
And so testosterone has its place. And I think that now that we've got medicine on board, and we've got kind of the population as a whole starting to see that it does have its place, we're seeing more and more people seek care for testosterone, with especially women, because it's traditionally a male-driven desire to have testosterone, because that is our primary hormone, sex hormone. So it's really, really nice to see that change.
I think it goes back to just patient education, because it's not something that is often explained to females, and that's unfortunate. But testosterone is absolutely necessary for a woman. It is not an elective hormone, and I think that we need to get rid of that common misconception and start educating women on what the hormones function is in their body, and how they all work together. And without testosterone, estrogen, progesterone, without all of these synergistically working together at the proper level, and cortisol, you have huge dysfunction. Your hormones are like a domino board, right? So if even one of them falls, even if one of them is out of place, then the entire rest of the system falls down too, or starts functioning not as properly as well.
Yeah. I think the reason why there was and I'm sure there still is a lot of fear around use of testosterone in a woman, because they think, okay, is my voice going to get deeper? Am I going to get more hair, potentially on my face? Am I going to have symptoms, more sebaceous gland, acne, for example? And the answer is no. At a low dose, at a safe physiological dose, that you're not going to have those symptoms. And that's one of those things where we're also tracking the entire time. We're taking blood work, we're monitoring symptoms. Obviously the patients are reporting back to us what they're experiencing, and then we're able to move the dose either up or down appropriately so that we can eliminate, even if those symptoms start to develop. I mean, there's the potential that they can, but it's highly unlikely.
Yeah. And I think also another thing that needs to be monitored carefully is not just how much testosterone is in the woman's body, but are they converting it properly? So is it being methylated, meaning able to be used in the body to do what it needs to do? So doing thyroid testing is extremely important, looking at T3, T4, because if you're just testing free and total testosterone in a woman, it might show very low levels, or it might show optimal levels. However, they might not be converting it. Same thing in men as well, absolutely.
Yeah, and I really do think that the Dutch test for women provides so much information. So yeah, you're getting your baseline testing, but you're also using Dutch in combination with it, which the Dutch test is going to show what cortisol levels are like. They're going to show androgen levels. And we're not just talking about testosterone too, also DHEA, because it's a huge function upstream from testosterone.
Go into that a little bit.
Well, DHEA is extremely important in the production of testosterone. And you can even see, so if you have low DHEA, obviously downstream, you're going to have low testosterone. So you're going to start from that higher point because that's what you need to feed, to develop, to make the testosterone. So just by changing DHEA, which is a supplement, right? So if we introduce that supplement, we can change now the numbers that we get in testosterone in women, and pretty significantly. That change as far as a percentage is huge by introducing the supplement for women. Men, maybe not the same thing.
So DHEA helps women to produce testosterone naturally.
Yep. So it's the precursor. So it's what's needed to make testosterone. Another thing with the Dutch test is we're able to see progesterone levels, which are extremely important to women. Also, all their estrogen levels, which estrogen is important for women when it comes to mood, their skin, it's their primary sex hormone. What were the other functions of estrogen?
Estrogen, everything
in a woman. Yeah. So it's important. Yeah. So it's important for heart health, brain health, skin, bones, metabolism, sleep, everything. So I think that a lot of women who are menopausal, postmenopausal, or maybe even premenopausal, they just have no clue how good they can feel. They think this is the new normalized feeling that they're going to have. Mm-hmm. And that's just not true. Once we pick apart standard labs, Dutch test, and are able to start regulating the progesterone, the testosterone, the estrogen, and the cortisol, because cortisol actually has a pretty serious, it helps control the pattern and the rhythm of those hormones as well. So you've got to get the cortisol to be functioning properly so that the hormones can function properly.
Yeah. And hormone health is very complex and complicated. And so I think that's why a lot of people, women and men, are both confused. What happens if you have too much estrogen, not enough progesterone? What happens if you have not enough testosterone, too much estrogen? All of these things, it's a very finite science to it. And it is complex. It is complicated. So
women are complicated. There's a lot of nuances to it. For sure. I always like to talk about me or men because I understand men so much better. But to your point about how all of these hormones, and even in men, progesterone having its function, testosterone, even estrogen, all of these things. So when I think about myself, I think, okay, I came off testosterone 8 weeks ago. I've been on testosterone for 10 plus years. So usually when I come off, I'm doing it to reset my ability to produce sperm, because it's, again, made in the gonads. And so I need to kind of wake them up again so that they're producing sperm. And then I go back to testosterone. Usually a month later, there's what we call post-cycle therapy, just to kind of keep my ability, my fertility alive. Now, I have to come off now for a pretty significant time so that I can actually produce healthy, viable sperm, so that my now about to be wife and I can, have children. And
let's talk about that a little bit, because I think that the off cycle for men of TRT, that is complicated as well and often misunderstood. So let's talk about why that off cycle is needed for fertility. Why does a man have to come off of testosterone if they are trying to have a child? And also, if you start it young, are you going to be fertile later in life? That's a big topic nowadays.
Yeah. So this is a little bit more complicated, but testosterone is a negative feedback loop. What does that mean? It means if I introduce testosterone into my body goes, man, I got testosterone. I don't have to make it anymore.
Right.
So, and again, the gonads, meaning your sex organ.
Your men.
And men, it's
your little men.
Yeah, your sex organs. It's producing testosterone. So again, by introducing it through a shot or pill or cream, then the body goes, I don't need to make it anymore. So then your gonads shut off.
So your sperm count decreases.
So your sperm count, function, all of that goes away. Hopefully it doesn't completely shut off. But if you were to use testosterone long term and continuously, if I did that for 10 years straight, I probably would shut it off completely. So that if I went back and I started doing a post-cycle therapy, which we introduced fertility drugs like HCG, gonadorelin, and clomiphene, tamoxifen. So all of these things to upregulate the gonads to start doing their thing again and producing sperm and testosterone, it may not go back to where it's supposed to be. So by taking those short little cycles, you're basically waking it back up enough to be like, I'm still alive, I could still do this, and then shutting it back off again to get back on testosterone. So that's why it's really important. If you're a younger man, you've got to make a decision and have to be committed to the fact that if you want to be fertile and reproductive in the future, you're going to have to do post-cycle therapy, and also know that there's a risk that you may also lose fertility. I know that's still a risk. Mm-hmm. So I haven't done the testing on the sperm yet to find out whether I'm fertile or not, but I know that I actually am producing the precursors, the sex hormones, because through blood work, mm-hmm. that I should be able to do it. Mm-hmm. So at least those things aren't shut off yet. But to the point is that I was going to make about testosterone. When I came off, and now that I've been off longer and longer, and it kind of keeps getting worse and worse, is I'm actually feeling all of the symptoms that a woman would feel, that men do feel when they have low testosterone, which is absolute brain fog, low energy, and depression. And I hate saying that word, but that's what I'm starting to feel, is depressed. And that's all because of low T. Everything else is optimized. I'm still living the same great life and treating my body in an optimized way. So it's testosterone alone that's causing these things. And then I'm starting to produce more estrogen. So I'm a little bit estrogen heavy. And with estrogen, I'm getting, the holding water. I'm maybe a little bit more moody, but that's also a combination of both, having low testosterone. And I don't like the way that I feel.
Yeah. Well, welcome to womanhood.
Yeah, or manhood with low testosterone. So
yeah.
That's the reason. And I've lost muscle. I'm not able to maintain, my body composition the way that I used to. And also my ability to make decisions and feel protective in a way, if you know what I mean, where I think with a man with a high testosterone, there's studies on this that they're a lot more decisive in their decision making. They're a lot more protective, and they stand up for what's right. Not that I've lost those things, but I can tell I've lost that kind of pep in my step, if you will. So it's not a fun place to be. And I think a lot of men operate with low testosterone and they act like that. And I think our society is now showing proof of that. There are a lot of men who are sitting in a chair, not giving it up to a woman, not fighting for a woman when she's being attacked, being a little bit of a little weenie, for lack of a better term, in life itself. We've got a lot of men, I think, with low testosterone.
And it doesn't just affect the man. So if you're a woman with a man that has low testosterone, that affects her as well, because it's basically like you're with another woman if you have severe low testosterone. And so maybe that woman doesn't want to be with another woman. Maybe she wants to be with the man. And if the man is moody and not decisive, that's the number one thing. Even going back to like, you get in the car, where are you going to eat? The woman like decides on 5 different places, says 5 different places, never decides. And then the man's like, we're going here. Women need decisiveness. And so this is such a generalization, but just in general, being with a man that has low testosterone, and also, them having low libido, makes the woman feel a little something.
She may have to operate in her masculine, if you will.
And she'll have to
because the man is not operating his masculine. A couple other things too with testosterone, especially when you're on testosterone and introducing it, exogenous testosterone, you can get a lot of conversion. So when you inject, then the body starts actually converting it to estrogen. And so that's the reason why blood work for men and following up on not just testosterone, but estrogen levels, and using, an anastrozole, basically lowering the estrogen levels.
Which is an estrogen blocker.
It's a aromatase inhibitor, but that would be one thing that needs to be paid attention to. But also progesterone, which I think is a little bit of a silent giant that gets ignored, which I ignored for a long time. Not ignored, but I should have done a little bit more blood work around it. But the take home is, if progesterone gets a little too low, then I started having some prostate dysfunction. And I won't go into detail what prostate dysfunction is like for a man, but when you're using testosterone. But once I reintroduced the progesterone, all those symptoms gone.
Yeah.
So you have to pay attention to the same sex hormones in a man as you do in a woman, and regulate them, watch them, and do the proper adjustments so that you can feel optimized.
Hormones are all about balance. If hormones are not balanced, if one is off even a little bit, then it throws the whole symphony off. You have to have all of them working properly and at the optimal range. And if they aren't, then you are going to have many side effects, and one off is going to affect the next one. It's a domino effect with hormones for sure.
Mm-hmm. Yeah.
I have a question to ask you. Okay. So let's say that we have a lot of patients come in and they have this worry. So they're mid 30s, early 40s. They are starting to feel the side effects of their testosterone dropping, and they still want to have kids. So we get the question a lot, well, if I start on testosterone now and I want to have kids in 3 years, in a year, in 5 years, will I be able to if I start TRT now? What is your take on that?
I mean, I think the take from our providers and our team is absolutely you can, but there is a known risk that potentially it could shut off your ability to be fertile, but
is that why?
Extremely low. And especially if you're doing those post-cycle therapies throughout and just kind of waking up the gonads so that they still function properly, then it can be done. But know that that's a lot of time. It's a lot of effort. There is a little bit of uncertainty. So are there better options? And I think that there are, but they won't get you the same effect that testosterone will. I mean, completely different as far as the ability to bump your testosterone up to levels which you're going to have, that your symptoms are eliminated. HCG, gonadorelin, and clomiphene, all fertility drugs, they'll preserve your fertility. They'll raise your testosterone naturally.
Whereas like Cypionate, injectable testosterone cream, topical, all of that, that's replacing it. So then these therapies that you're talking about, what were they?
Gonadorelin and clomiphene, tamoxifen. So
that helps your body to produce it naturally. So does it matter if your body is producing it naturally at 600, or you're taking Cypionate and it's getting you to that 600 number? You feel the same whether or not you've taken it by an injection or topical, or you've gotten your body to produce it naturally to that level, correct?
What's the question?
So does it matter? Let's say that the number is 600 for testosterone. If you are at that number, does it matter how you got there? Whether or not you optimize your body and your hormones to produce that naturally?
So your question is, if you naturally at 600, or if you take testosterone and get to 600, which means you were probably lower than 600 at your natural state, does it matter what specifically?
So do you feel more energetic, more alive, more vitality when you do TRT, testosterone replacement therapy, rather than when you do therapies to help your body to naturally produce testosterone on its own? If you're at the same, let's say one person does this, they get to 600, they naturally produce it on their own with therapies that we do. The other one is they just replace the testosterone, and then they're at 600 too. Do the two people feel the same?
It's hard to say. That's a really good question. I think it comes down to the host, right? So the individual. 600 for one, which we talked about this in previous podcasts. Lab values of 600 for one person might mean no symptoms, feel amazing, and for another person it might mean I still have all the symptoms in the world. So it's irregardless of whether you did it naturally or you introduced testosterone and you're hitting 600. 600 is a very subjective thing, I think, and it's really hard to determine. That's the reason why we don't just look at lab markers. We ask the proper questions in our follow-up. How are we feeling? Have these things changed? Have these symptoms improved? And if they haven't, then maybe we need to make some adjustments, and it needs to go further than 600.
Wouldn't it be nice if there was a test that told you exactly what the levels for you specifically were to be at for both men and women, but especially with testosterone? Because like you said, every person is different. So a 600 for one person might feel like a 200 for another person in testosterone levels in blood work. So wouldn't it be great if there was a test where you could literally see, oh, Bob needs 600, Adam needs 1200, Sam needs 400.
Isn't it? Well, I mean, wasn't there some genetic testing that you used to be part of, and they were able to pick apart that, like the genome a little bit further and figure out certain details of like how certain prescriptions affected you?
Yeah. So pharmacokinetics and pharmacogenetic testing. Yes. So there is those tests, but that's more so it's not for where your body will naturally be. It's more methylation and how your body methylates certain medications. So some people's bodies, they could take the exact same amount of, let's say, Tylenol, and they will feel absolutely nothing due to their genetic makeup. Whereas another person can take that exact same amount and then they feel complete relief.
Okay.
Yeah.
So hopefully the information that we shared today around testosterone, hormones related men and women, give you some value. So if you have any questions, feel free to comment in our comments section and like and subscribe. See you next one.
Have a balanced day.